Hello, my viewers. Welcome to another segment of Med Hour with Dr. Stella. To all my new subscribers, welcome. To my old subscribers, thank you for coming back. Glad to have you. On this segment, we will be discussing different things you can eat to help reduce your blood pressure and also reduce your risk of having a stroke. You know that whatever we put in our body has a very significant impact on our well-being. So today we are going to look at all those foods that we eat and how they will impact us, especially our blood pressure. The first thing we are going to look into is the kind of diet you're supposed to eat when you have high blood pressure. We recommend for you to eat what we call the DASH diet. DASH diet means that you have to eat low sodium diet low in carbohydrate or sugary foods, decrease your intake of saturated fat, and also increase your fruits and vegetables. Sodium and potassium, these are the two minerals that are very important, especially if you have high blood pressure. Sodium tends to increase your high blood pressure, while potassium helps to normalize it. In essence, if you eat a very high sodium diet with a lot of salt, the tendency of your blood pressure going up is there. If you eat a diet enriched with potassium, definitely it will control your blood pressure. What are some of these foods that are high in sodium or salt? First one is canned food. Something like sardine. Most of us grew up eating sardine. Sardine is good for you because it does have fish. However, sardine is loaded with salt, so you have to be very careful eating that if you have high blood pressure. Have to be careful eating processed food like cereal. We take cereal in the morning and cereal is good for you, but however, always read the label. Make sure it doesn't contain high sodium content. Also, ensure that when you're cooking your meal, you're not adding things that already have sodium in them. We cook with Maggi cubes or not cubes. Those contain a whole lot of salt. Your recommended salt, daily salt, 1 cube is good enough for it. So think of cooking your food, adding Maggi or not cube into it, or even adding other spices into it with salt. You are definitely increasing your salt intake. Also, frozen dinners. Most people like frozen dinners. Like I said, always read the label. Frozen dinners, they have a whole lot of salt intake in them, and you tend to increase your blood pressure doing that. Nuts. Nuts are good for you, they're good for your heart. However, if you're taking salt, take a handful. Peanuts, ground nuts, almonds. Make sure when you're taking them, you take the ones that are no salt added. So if in the process of giving yourself a healthy heart, you don't want to increase your blood pressure. So look for nuts that are less salty or no salt added at all. What are potassium-rich diets? Potassium-rich foods are food that contain a lot of potassium that are good for maintaining your blood pressure. Bananas are good sources of potassium. Oranges are good. Fruits and vegetables. Spinach. Our local ugu is good for you. You could also do cucumbers, raisins, potatoes. These are all good sources of potassium. But if you're diabetic, talk with your doctor. Make sure he or she understands that you're increasing your fruits, because fruits do contain a lot of sugar. And sugar is not something we want you to increase if you're diabetic. What are the foods that can trigger you to have stroke? These are pretty much the food I've mentioned. Salty food, food that are processed, bread, pre-packed food, cereal that I've mentioned, If you like to eat chips, cut down on your chips. If you want to eat crackers, crackers are good, but make sure you are getting low sodium or no salt at all crackers. Certain meats, not all of them, have a whole lot of salt in them, like smoked meat. If you're eating smoked meat, you're getting a lot of sodium. Our local suya, when you take suya, suya has a lot of sodium in it. Ham also has sodium. Bacon, sausage that we take in the mornings, those are very high, they have very high contents of sodium. So make sure you're cutting down on the kind of meat. You can do poultry, you can do chicken, you can do fish. You cook it yourself, you don't have to add salt to it. If you really have to season your food, you can use spices like powdered onion, ginger, garlic. You can use it, even a dash of salt is good. One thing, we don't want your sodium to be very low. We still want you to have sodium in your system. But when you use it sparingly. Or maybe once in a while, every other day, every other 2 days. I have some of my patients, they will ask me, what do you think about sea salt? Can I use sea salt? Sea salt is good. Actually, it does contain a little bit of sodium compared to the ones you buy in the store. But one thing I want to reassure you is the sodium you buy in the store contains iodine, and we want you to have iodine in your system. The sea salt does not contain iodine. So when you buy sea salt to use to cook, make sure from time to time you add your regular salt, because you do need iodine in your system. Another food that you also want to watch when you're trying to prevent your blood pressure from going up is sugary food. A whole lot of food contains sugar. Look at the label, make sure there's no sugar or added sugar to it. Something like soda, that's a whole lot of sugar, it has a whole lot of sugar. Energy drinks, sports drinks, pastries, our meat pies, fish roll, they all contain a whole lot of sugar that you don't want. What does sugar do? Sugar makes you gain weight. When you gain weight, your blood pressure goes up. If your blood pressure goes up and your blood pressure is not controlled, the possibility of you getting stroke down the road is there. So make sure you're watching all these things. Ensure that you're limiting the amount of alcohol you're taking. Actually, red wine is good for your heart. If you can take red wine with dinner once every day, 8 ounces, just a little 8 ounces of red wine is good for your heart. I don't want you to overdo it. Don't do it 3 times with 3 meals. Just with dinner is better. It can help relax you before you go to sleep, and also work on your heart to make sure that you're doing fine. Limit your alcohol, like I said. Drink it in moderation. As well as watch your salt intake, watch your sugar containing food that you take. Exercise the much you can, at least 3 times a week with moderate intensity. When you've done all this, I bet you, trust me, that your blood pressure will be controlled, at least controlled with the medication that your provider is taking care of you with, and you will decrease the risk of having a stroke in the future. I will see you again in my next segment. Thank you and be well.